Hi, I am Dr. Samir Ben Osman, and in this video we're going to talk about the principle of medicine. So medicine is the study of diseases, the study of their diagnosis and treatment, as well as their prevention. And just to follow on the video about physiology, so we saw that physiological processes, they do everything they can to maintain equilibrium and homeostasis. And so any imbalance in the physiological functions that cannot be compensated for is going to cause diseases. And these diseases need to be diagnosed and treated to restore, again, this equilibrium and homeostasis, or at least to prevent or slow down further deterioration. That's kind of one of the main goals of medicine. So let's talk about the diseases and their characteristics. From what we know, and depending on how they're defined, there are about 10,000 known human diseases. 95% of which are actually rare diseases, and rare means they affect less than 0.05% of people. And about 500 diseases have a known treatment, and fortunately most of these 500 diseases are non-rare diseases. These diseases can cause manifestations that are called symptoms that are either acute, i.e. they last for days or weeks, and can either lead to complete remission in most cases, or death in less cases, or they can progress to lower intensity chronic diseases that persist for months or even all life. Diseases can cause universal responses such as inflammation, as well as organ or system-specific dysfunctions, and we're going to talk about each one of those a little bit more. So the general symptoms, the leading general symptom is inflammation. And so the inflammation is present in the majority of acute diseases and almost the entirety of chronic diseases. And the inflammation is basically the immune system's response to various insults in the body. So the acute response is initiated by either protein fragments or pathogens called pathogen-associated molecular patterns, or PAMPs, or by damage-induced molecular patterns, or DAMPs, that are released during cellular stress or cellular damage. These PAMPs and DAMPs will start the kind of attack and clear response by the immune cells, which will produce pro-inflammatory proteins such as prostaglandin and others. And these proteins will have various effects that improve actually the response, such as causing fever, and fever, by the way, increases the body temperature. And the body temperature, when increased, is actually optimal for the functioning of white blood cells. And it's disturbing, and it doesn't make comfortable the bacteria, because the bacteria doesn't like those high temperatures. Also by causing pain to signal distress, etc. They also produce special kind of chemicals called reactive oxygen species, or ROS, like oxygen peroxide, H2O2, or NO. And these species are basically, like their name suggests, very reactive. So they will seek anything they can exchange electrons with, and they will basically disrupt it. But they also have specific functions in the body. So NO, for example, opens blood vessels, and that's going to call for more white blood cells and enable them to move from lymphatic cells to the bloodstream, but also cause tissue and cell injury just because they're not so specific. And they will attack proteins, they will attack lipids, deform them, and can cause all sorts of problems in cells, reactive oxygen species. Now, this is in acute inflammations, but in chronic diseases, which include, by the way, cancers and diabetes and depression and dementia, we have low-grade chronic inflammation, and this time it's triggered by DAMPs in the absence of PAMPs. And so it signals to the body there is damage, there is damage, there is damage, you gotta inflame. But basically it's the one that's causing the damage. And so more reactive oxygen species, more damage, more DAMPs, etc. And it further progresses chronic diseases. And so it's imperative to deal with the inflammation, especially with the chronic inflammation, because it can become the major component of those diseases, or the major destructive force, let's call it. So we spoke about the general symptom of inflammation. Let's give some examples of system-specific dysfunctions. And there are many, many of them. We're not going to be able to give like a comprehensive list, but just giving some examples to give an idea of the principle of the way kind of a doctor will have to think about those symptoms. So depending on the affected system, imbalances can lead to low blood and tissue oxygenation called hypoxia, which could be due to reduced lung capacity, so not able to bring oxygen to the blood, or by reduced heart capacity to pump the blood, or by narrowing of the arteries, so they're not able to transport enough blood with the oxygen, etc. You can have low water in the blood due to low intestinal absorption, low blood water retaining proteins, leakage of water retaining proteins in urine due to kidney disease, and many other kind of causes. You can have low absorption of nutrients into the blood caused by intestinal infections or by parasites or by low digestive enzymes in the bile. You can have low blood coagulation due to the unlimited or limited production of coagulation proteins by the livers due to probably a kidney liver problem, etc. You can have low bone density and kind of leading to high risk of fractures due to low calcium in the collagen that's in the bones, or lack of its binding to the collagen by lack of vitamin D, etc., or by the accumulation of toxic byproducts due to kidney or liver malfunction, or the accumulation of glucose in the blood due to malabsorption by the cells, or to memory loss due to excessive death of the memory neurons, etc. And these functions can have many ramifications that occur actually simultaneously, which makes diagnosis quite difficult at many times. So what are the diseases of the major diseases that cause the major causes that cause diseases? So diseases have mostly environmental, infectious causes, then followed by genetic or unknown causes. So let's talk about the environmental causes. So the environmental causes can be basically beginning with trauma, so like a body injury or fracture or something like that. Or it can also be, or much more often, caused by unhealthy diet, such as eating junk food that is high in short sugars and lipids, and poor in fibers, which causes diabetes, obesity, and most cardiovascular diseases. Lack of functional exercise, i.e. physical exercise, as well as mental exercise, which cause cardiovascular diseases and increase the risk for dementias like Alzheimer's. Also, we have one of the leading causes is industrial toxic products in the air that cause pulmonary and respiratory diseases. And then we have infectious causes that are caused by bacteria and viruses. And I just want to note here that most bacteria, viruses, and fungi are actually harmless to humans. And actually many bacteria and fungi are essential for human physiology because we outsource a lot of the functions to them, because they enable us to digest otherwise undigestible fibers. They produce essential vitamins. They actually prevent the harmful bacteria from taking root by occupying all the available space in the intestines and in the lungs, in the skin, etc. However, this minority of bacteria and viruses and fungi, as well as parasites, will cause infections. And basically their goal is to hijack the body's resources to grow and multiply their own, to multiply themselves. And they will do so at the expense of our own tissues. And so they will multiply in tissues such as the bacteria or the fungi, or they will multiply inside the cells, mostly viruses, but some bacteria as well. And in doing so, they will inevitably cause destruction of the tissues or cells that they're hijacking. And so they will also reduce the efficiency of the physiological functions, and they will cause inflammation because they will be detected by the immune system. And the inflammation can also cause damage and sometimes actually aggravates most of the symptoms, like in COVID, where it aggravates the respiratory disease. So in addition to these leading causes, we have less common causes, such as the genetic causes, which are caused by mutations in specific genes that will encode for specific proteins. And these mutations will basically have the wrong amino acid put in the wrong place in the sequence of that protein, which renders that protein in most cases non-functional. And so it will basically disrupt the physiological process that the protein intervenes in. And depending on where this protein intervenes, such genetic diseases can be either mild or life-threatening. And you can see here, for example, an example of a genetic disease, which is called sickle cell disease, which is a mutation in a gene that makes the red blood cells less capable of transporting oxygen, and it makes them gives them this appearance of being like a sickle. And then we have other causes that are less known origin or sometimes unknown origin, and they revolve around exacerbated immune response to otherwise normal body cells. So like, for example, cartilage producing cells in articulations can be attacked by the immune system in what causes rheumatoid arthritis, or insulin producing cells in the pancreas that get attacked by the immune system and killed in what causes type 2 diabetes. Or these immune responses can be kind of exacerbated by nutrients that are otherwise healthy, like peanut proteins or shellfish proteins that cause an autoimmune response called allergy. So we have basically autoimmune diseases and allergies, and the causes of these are still not kind of well understood. So with those causes, what are the most notable diseases, the most deadliest diseases to date? So the leading deadliest disease is the group of cardiovascular diseases, and it's mostly due to the poor diets, like we said, high sugar, high lipid and low fiber diets, also smoking, sedentary lifestyle, no workouts or low physical activity, stressful lifestyle. And so these are the leading causes of cardiovascular diseases, which are the leading causes of death in the world. They will be followed by respiratory diseases that are due to air pollutants as well as respiratory infections, mostly airborne viruses like the flu, influenza, kills millions of people every year, and air pollution, as well as the low immunity in the individuals that's going to cause the bacteria to infect their lungs and cause pneumonia, as well as respiratory cancers that are in part due to smoking and air pollution. So you can see how air pollution has a lot of effects on respiratory diseases. That's followed by Alzheimer's disease, which origin is still unknown. There are still kind of some hypotheses on its origin. Actually, inflammation being potentially one of the accelerators of Alzheimer's, but the origin is still not known. And it causes kind of the loss of neurons and the loss of the activities of those neurons, be it memory or other activities. And you can see on the left-hand side a normal section of the brain compared to the right-hand side, a brain of a patient who died with Alzheimer's, and you can see how much brain tissue has been lost during the disease. After that, we have diabetes that is caused by a genetic component, but the genetic component is actually a minority. The majority of the causes of diabetes is the sedentary lifestyle combined with the unhealthy diet. And then followed by liver diseases, mainly cirrhosis, which is due to alcohol use, then followed by unhealthy diets, and then followed by the hepatitis virus. Although the hepatitis virus now is being treated, and actually we have full remission from viral hepatitis. But the cirrhosis is like one of the leading causes now of liver disease, which is one of the leading causes of death in the world. And you can see here a healthy liver on the top compared to a liver that's been inflamed with cirrhosis, and you can see how much tissue damage occurred during the disease. So this is an overview of the deadliest diseases in the world. So how do we diagnose those diseases? The symptoms, like we said, can be quite confusing because many diseases can cause similar manifestations, and also because the same disease manifests differently based on the patient, him or herself. So based upon the age, the gender, genetics, lifestyles, the manifestations of the disease can be different, and the environment also can affect how the disease manifests itself. If there is pollution or not, if there are infectious regions or not, seasons, geography, etc. And so the diagnosis needs to, quote unquote, remove ambiguity to find out the correct disease that's causing the problem. And the principle here is to find the probable cause with the least cost and with the least damage to the body. And so we're going to use as much as possible non-invasive approaches to find what disease the patient has. Just of note, rare diseases are even harder to diagnose, and actually the hardest to diagnose because they have very low probability of occurrence, which means that doctors almost never think of them first and always confuse them with other more common diseases. And sometimes it can take years. On average, actually, in the UK, I think it takes 4 to 5 years to diagnose a rare disease after trial and error and try and error. And so what are the tools of diagnosis? So the diagnosis is based on asking questions to the patient. That's the first thing, to understand when did the problems occur, how did they occur, etc. And then performing what we call a clinical exam, which is to check easily accessible parameters, listening to the heart, listening to the lungs, to the stomach, etc., testing reflexes, etc. So these are kind of the easily accessible parameters we want to check. And then based upon that, the doctor is going to formulate initial hypotheses on, I'm thinking of disease A, B, and C. But in order to, again, remove ambiguity, the doctor will probe biological markers in bodily fluids, so either in blood samples or urine samples, etc. And he or she will look for specific things that either confirm or disprove the hypothesis that he formulated about the disease. So he or she will look for a cell count or regulatory protein levels in the blood, or level of nutrients in the blood, or level of byproducts in the blood, or the presence of unusual products in urine, for example, such as glucose or proteins that are not supposed to be found in urine, etc. And then also, as needed, again, to confirm or deny the hypothesis of the disease that he or she is thinking about, imaging can be ordered using basically physically penetrating elements like X-rays or radiations or ultrasound, or using the properties of magnetic resonance, which is called MRI, to view structural changes inside the organs without being destructive, basically just like non-destructive way. And sometimes, if we need to, we can use more invasive techniques, such as endoscopies, where we put basically cameras inside the body to see what's going on, or biopsies, where we extract a sample from inside the body and take it to the lab for analysis. And these are kind of a little bit more invasive, and we try to avoid them as much as possible. So then, once we have identified the disease in question, how do we treat it and how do we prevent it? What are the principles and approaches for treatment? First, the prevention is the best of treatment. So the environmental correction is the most effective of preventions, and it consists of healthy nutrition and physical exercise and mental exercise to prevent the large majority of the most dangerous diseases. Also of note, intermittent fasting has been proven by many studies actually to be able to reduce inflammation by almost kind of quote unquote calming down immune cells. And we've seen the damage that inflammation can cause. And also it cleans cells from the inside, from the accumulated byproducts, through a process that's called autophagy, whereby basically it digests, it causes cells to start the program of autophagy, whereby they digest non-functional proteins or organelles, etc. And basically they clean themselves from the inside. So highly recommended. And also physical exercise, which lowers blood glucose and lowers lipids, and also acts as an anti-inflammatory, natural anti-inflammatory. So it kind of calms the immune system from the exacerbated responses. But it also actually improves the immunity to the actual threats. Now, in addition to that, if we have traumas that have been caused to the individual, physical therapy can be prescribed, which the principle of which is the progressive restoration of motion in the affected area. So you can see here an example of a knee, person having a knee trauma or knee surgery, and they need to recover the motion. And so there are many techniques that are employed in physical therapy to progressively restore back this motion and reduce the pain as well. Also among the tools available to treatment is surgery, and the principle of surgery is to remove the affected tissue, such as a tumor or others, or to replace non-functional parts, for example, such as knee replacements or hip replacements with implants, or to restore functions of physically torn ligaments or nerves, etc. But the most prevalent form of treatment remains pharmaceutical medication, which is basically the principle of which is to use drugs that bind specific proteins and mostly blocking their activity, and so blocking the pathways that go through them. And we hope that those pathways are the main causes of the disease that we're trying to address. So, for example, if we have an infectious disease due to bacteria, we're going to give an antibiotic, and this antibiotic is going to go inside the bacteria and block vital processes in the bacteria, thereby killing the bacteria. Or at least we can use medication to reduce the harmful symptoms that accompany the disease. For example, inflammation. So we can give drugs that are anti-inflammatory, that are going to block the enzymes that's going to activate the pro-inflammatory proteins. For example, aspirin, which is called salicylic acid, acetyl salicylic acid, actually blocks a known enzyme called cyclooxygenase, and cyclooxygenase is the one that activates the proteins that cause the inflammation. So that's how aspirin works. It's important to know that no drug is selective enough to only act on its target proteins. And even when it does, the target protein itself may serve other functions in completely unrelated tissues. And so this causes drugs to have what we call side effects. And these side effects can range from mild to severe. Also, most drugs are deactivated through liver cells proteins, probably the most notable of which is a specific protein called CYP3A4. CYP3A4, you can Google it. Or some drugs can be cleared by the kidneys. And so some of the drugs actually can be toxic for the liver and the kidney as they go through them. One last thing that I want to kind of point out for drugs is that drugs may also compete for the same clearance pathway, and that makes them stay longer in the body. So if you have two drugs that use the same enzyme in the kidney that deactivates them, well, if you take them both at once, the kidney can only do so much at a time, which means that the drug will stay longer and do more effects and maybe more side effects. And with that, we came to the conclusion of our section on the principles of medicine. I welcome your comments, and I'll see you in the next video. Thank you for your attention.